coming back to the symptoms of IBS, again, I want to acknowledge that sometimes you may go to a general practitioner, to a gastroenterologist, and they give you it's IBS, without feeling like they're digging and they're trying to give you therapeutics that can help improve the IBS. The unfortunate thing about that scenario is it ignores all this data we have on probiotics and their ability to improve IBS. And why that matters is the IBS symptoms are unpleasant. People don't want to have bloating, pain, discomfort, constipation, diarrhea. If we can reduce the symptoms, we can alleviate a lot of suffering. And oh, by the way, at the same time, that symptomatic reduction seems to correlate with improvements in things like Candida and in leaky gut, at least for the most part. So the study here is a 2023 observational study looking at 37 patients with IBS. They were given Bifidobacterium longum at a dose of 1 billion per day. Again, pretty standard stuff regarding dosages. They found that probiotics improved the IBS symptoms in 60% of individuals, including gas and bloating and abdominal pain. And to quote, "We conclude that an 8-week course of probiotics was associated with significant, clinically meaningful symptomatic relief." So this is great news, and I just wanted to share this study as a growing number of studies showing that probiotics can improve symptoms. There was another trial in a similar vein, randomized control trial, 307 IBS patients given placebo or probiotic. In this case, there's an interesting twist. Now they used Lactobacillus plantarum, nothing special, nothing new, nothing proprietary about this. Here's the twist. At a dose of either 1 billion per day or a dose of 10 billion per day. They found that the 10 billion per day, the higher dose, was actually better at improving the symptoms, leading the researchers to quote, "Probiotics reduced IBS symptoms by more than doubled compared to placebo. Also, the higher dose probiotic group demonstrated a greater benefit compared to the lower dose group." We'll come to the dosing guidelines in a moment, but one of the things that we've been really attempting to summarize, especially last year and this year, 2023, 2024, is what is the optimal dose? And we've been saying somewhere between 1 and 50 billion seems to be the best. More doesn't always seem to be better. In fact, I think shooting for the minimal effective dose is probably the best strategy. This study would suggest that while yes, aiming for the minimal effective dose is good, there's also, the need to echo minimal effective dose. Meaning, let's say you started at 1 billion per day. Give that a few weeks, assess, and then if you wanted to increase your dose to see if a higher dose was more beneficial, you could do so, continuing at whatever dose, whatever the lowest dose is that leads to the best improvement in your symptoms. Another study here I found interesting as it pertains to constipation. You hear a lot about constipation, about motility. The motility apparatus is essentially this neuromuscular lining of your GI tract that helps propel stool through and out the other side. And you'll hear things about you need prokinetics and certain drugs or natural agents that are targeted at the motility, which is all fine and good. But look at this meta-analysis summarizing 13 studies. They were comparing those prokinetics used alone versus the prokinetics plus a probiotic. Now, the probiotic they used was a blend of Lactobacillus species, Bifidobacterium species, and also soil-based or bacillus species. So it's a nice blend of different types of probiotics. Looking at a dose of 1 billion CFU per day, they found that probiotics, when added to prokinetics, led to a 4 times greater improvement in motility than just using a prokinetic alone. And this brings in a point I've made on the podcast many times in the past, which is when you have dysbiosis, when you have these imbalances in the flora, whether it's an overgrowth of Candida, whether it's a skewing of the ratios of certain bacteria from healthy to unhealthy, whether it's small intestinal bacterial overgrowth, any of these imbalances will lead to inflammation. And together, this sort of leads to a confluencing or a self-perpetuating cycle in which the imbalances fuel inflammation, those make each other and also leaky gut worse. And in this, especially the inflammation, leads to an inability of that motility apparatus to heal, to repair, and to regenerate. In fact, we know that neuromuscular lining of the gut that regulates motility can repair itself quite robustly. But two things can hold back that repair. One is dysbiosis, or imbalances in the flora, and the other is inflammation. And they're kind of, to some extent, speaking loosely, different sides of the same coin. This diagram from Frontiers in Nutrition, I think is important to cue in on this one aspect in particular. It's looking at probiotic therapy, and this paper actually documented multiple mechanisms through which probiotics can improve constipation. I want to zoom in on the one, which is increasing propulsive motility, meaning that ability to propel stool or move food stuff through the GI tract, eventually becomes stool and gets moved out. And the other thing here, you see this little note, 5-HT, 5-hydroxytryptamine, aka serotonin. Serotonin is a neurotransmitter that regulates motility. And I wanted to just quote this systematic review. The robust evidence compiled and presented in this review indicates that treatment with probiotics may improve symptoms associated with MDD, major depressive disorder, by increasing serotonin availability and or decreasing levels of inflammatory markers. We know that the largest density of immune cells and one of the greatest hubs of serotonin and inflammation is your gut. We've also discussed meta-analyses that have found, like this paper is hinting at, that probiotics can improve depression. One of the mechanisms may be through improving serotonin, and certainly it makes sense by reducing inflammation. Both of these mechanisms could improve mood, but it's also one of the reasons why we see improvements in motility. So I wanted to make that connection because depending on what you read or who you listen to, you may hear prokinetics for motility, again, which I have no issue with, but don't forget the importance of probiotics for motility. Okay, so coming over to one study that did not find any benefit from probiotics. As we're following the research literature here, I want to present to you a balanced argument. This was a 2023 randomized control trial in women with IBS. So again, looking at the symptoms, they compared a low FODMAP diet alone versus a low FODMAP diet combined with probiotics. They did not find any additional benefit of the probiotic plus low FODMAP diet being any better than the low FODMAP diet alone. Now, you can look at this different ways. I look at this as a good reminder how important it is to start with food first. I also want to mention that there are other studies finding better results when probiotics are combined with a low FODMAP diet. But as in any body of data, you're going to see differences in the finding of a therapeutic. So sometimes the combo of low FODMAP diet with probiotics is beneficial. And as this study found, it was no more beneficial when adding the probiotic to the diet. Part of the reason we see similar benefits and maybe no additional benefit in this trial is due to the overlap in how the low FODMAP diet or probiotics heal and improve the gut. We know that either one of these, either a low FODMAP diet or probiotics, can reduce leaky gut. We also know that a low FODMAP diet can improve dysbiosis and also SIBO, or small intestinal bacterial overgrowth, gas levels. And additionally, that you can lower GI or digestive tract inflammation either with a low FODMAP diet or with a probiotic. I look at this study as good news, meaning you have options to improve your gut health, whether it be low FODMAP or probiotics or both. And the final study here, or one of the final studies I wanted to go over, looked at different types of probiotics to see, do different types have different benefits they can offer the person supplementing. It looked at 123 patients with IBS, and they compared Bifidobacterium lactis at a dose of 5 billion per day versus Bacillus coagulans at a dose of 2 billion per day. So the Bifidobacterium is one type of probiotic and the Bacillus is a different type. They found that the Bifidobacterium improved frequency and the intensity of abdominal pain, whereas the Bacillus led to more improvements in bowel satisfaction. So I look at these as not very different from one another, but let's quote the researchers here and then I'll come back with a few other comments. In conclusion, single strain supplementation was safe and effective in IBS patients, but showed a different range of effects. Bifidobacterium lactis primarily reduced the frequency and intensity of pain, while Bacillus coagulans increased bowel satisfaction. Part of how I've interpreted data like this is that if we use a blend of different probiotic species, we will have broader benefit. And we've developed this diagram to help sort of portray this concept. The way I look at this is you can organize probiotics into 3 general types as a heuristic that makes simple the very confusing landscape of probiotics. Blends of Lactobacillus species and Bifidobacterium species as one type. Saccharomyces boulardii or perhaps Saccharomyces cerevisiae fungus as the second type. And then the third type, soil-based probiotics, which usually contain some type of Bacillus species as this study looked at. And together, you'll have a broader benefit and it will be more conducive to balancing the microbiota and healing imbalances. This hasn't been officially published yet, but it's a trend you're seeing. If you study the various research papers carefully, this trend seems to be emerging. I can't say there's conclusive proof, and we are hoping to, at some point, publish a comparative trial looking at one formula as compared to 3 formulas together. But this is more so a clinical observation combined with, again, the trend that if you look closely, you're seeing being published in the research. Okay, the final study that I think nicely supports this concept. This was a large network meta-analysis summarizing 81 randomized control trials in over 9,000 patients. So when people tell you there's not good research on probiotics, that is a clear admonition of them not following what's being published. When we have a meta-analysis, a network meta-analysis of 81 randomized control trials, that's huge. And they wanted to examine what were the most effective probiotics for IBS. They found that Lactobacillus species were one of the most effective. Bifidobacterium species were another one of the most effective. Soil-based or Bacillus was another one of the most effective, and Saccharomyces, specifically in this case, cerevisiae, was another one of the most effective. And this is nice support for this meta protocol we've been developing over the past few years that summarizes all this research down into a simple, all-purpose probiotic protocol. And what you see here is very familiar from what this study found. A blend of Lactobacillus and Bifidobacterium as one type of probiotic to be used at a dose of anywhere from 1 to 50 billion per day. Secondly, Saccharomyces boulardii. We've recommended Saccharomyces boulardii. This paper found benefit for Saccharomyces cerevisiae. I think it's still contestable in terms of one, the other, or both, but nevertheless, you're getting the type of probiotic, Saccharomyces, which is a healthy fungus. And that's at a dose of 10 to 15 billion per day. And then finally, the Bacillus, or the soil base, also as this paper concluded, one of the most effective, at a dose between 2 and 6 billion per day. So in the studies that we've discussed today, across all the studies, you see a dose range between 1 and 20 billion per day. Our upper limit is a little bit higher for the Lactobacillus and Bifidobacterium. Namely, this comes from the fact that in certain immune and neurological conditions, like depression as one example, or SIBO as another, you're sometimes seeing doses of 50 billion, 100 billion, even 200 billion of the blends of lactobacillus and bifidobacterium. Remember, this paper was looking strictly at IBS. Our meta protocol looks at IBS, IBD, SIBO, Candida, depression, atopic immune conditions, and attempts to distill that down to an all-purpose protocol.